South Korea was once hailed as a country that successfully contained the coronavirus outbreak. But over time, the reality has changed. On Tuesday, South Korea recorded its second highest daily spike in coronavirus infections. 1,092 new infections were reported on Tuesday itself, just a few cases short of setting a new daily record, which was set just a few days earlier. Since the pandemic began, South Korea has registered over 52,000 infections, almost 13,000 from which were reported in the last 2 weeks. The East Asian country is currently struggling with the third wave of coronavirus infections. South Korea's capital, Seoul, is the country's worst affected region. Reports suggest that healthcare workers are struggling to keep a track of new cases, which they say seem to be popping out everywhere. To combat the spike in cases, South Korea has reinforced strict social distancing norms.
인가 이동량이 증가할 것으로 예상되는 성탄절과 연말 연시의 위험 요인을 관리하고자 내일부터 1월 3일까지 특별 방역 기간을 운영합니다. 현재의 엄중한 상황을 고려하여 5명 이상이 모이는 사적 모임을 하지 않기를 강력히 권고드립니다. 특히 수도권에서는 지자체에서 발표한 바와 같이 5명 이상의 사적 모임이 금지됩니다.
Under the new measures, gatherings of over 5 people are banned. Restaurants will face heavy fines if they accept group bookings. All national parks and ski resorts have been declared shut. And operational hotels are prohibited from selling more than 50% of their rooms during this period. Amid rising cases, South Korean President Moon Jae-in is facing major backlash for his vaccine procurement plans. Moon Jae-in came under heavy fire from the local media. They called his plans too relaxed and overly reliant on local vaccines. A recent survey suggests that South Koreans believe urgency should be prioritized over safety when dealing with vaccines. South Korea was once a success story, but critics say the country gambled on its own success. South Korea eased social distancing restrictions to the lowest level during fall. The decision was taken to revive the slowing economy. Despite repeated warnings from health experts, the government went ahead with easing the curbs. Joining us on this broadcast is American political analyst and professor at Busan National University, Dr. Robert Kelly. Dr. Robert, thank you so much for talking to WION, giving us your time. Now, 1,000 plus cases in the last 24 hours in South Korea. Now, while this number standalone may not raise alarm bells in countries that are recording thousands of cases like America, like Britain, several European nations, the numbers are far higher. But for months, South Korea had largely contained the spread of the virus. This is the second highest rise in numbers in South Korea. It is a cause of concern as far as South Korea, the country, is concerned, isn't it? What's driving this sudden surge in cases?
Yeah, probably the Korean Centers for Disease Control are working on that right now, but probably what's driving it elsewhere, which is to say the colder weather is pushing people indoors, and then they've also had a series of holidays. There was a major Korean holiday a few months ago, and now, of course, you have sort of Christmas coming. Schools have closed, which means children will be at home, and so the virus is spreading. There's no particular reason why the South Korean government can't get this under control. The South Korean government has dealt previously pretty successfully with the other waves, right? But the real issue, as you mentioned in your opening there, is the discussion of vaccines to come, right? The Koreans can sort of contain and limit this, but the question is whether or not the vaccines will come.
Right. Now, a recent survey suggests that 6 out of 10 people in South Korea believe that urgency should be prioritized as far as procurement of the vaccines is concerned. But it appears that the South Korean government doesn't believe so. A recent government spokesperson recently said that these countries, he's referring to the countries with many more cases and those who have started the vaccination drives. He says these countries are somewhat inappropriate for us to take as teachers, and considering the process of safety checks, we believe there is no reason for us to be the world's first or second country to receive the vaccines. So is the Moon Jae-in government erring on side of caution? Is it right for them to be cautious given the rising number of cases in South Korea? Should they be more urgent in procuring the vaccines?
Yeah, I think that what's going on is that the Koreans actually did a pretty good job of containing this, so the government was more comfortable allowing the standard research process to go through for a new vaccine. In other words, in many other places, the United States being most obvious, right, where you had Operation Warp Speed, the idea was to sort of push the development of a vaccine as rapidly as possible. That was in response to the exploding caseload in the United States, right? I mean, America now has something like 300,000 dead and, like a couple million, right? Infected. You don't have anything like that here in South Korea. It's just not like that at all, right? And so I think because the South Korean government has been able to keep this thing down from the levels seen in other places, the South Korean government was willing to stay with the traditional vaccine approval process. Right, but the Koreans are able to watch the news and see what's going on in other countries. Right, they see that Britain is getting it. They see that Dr. Fauci, Anthony Fauci in the United States is getting it on television and things like that. And they want to know why it's not happening here. And I think it's a fairly similar debate to many other places, which is, do you want to sort of gamble on the vaccine coming quickly with possible safety fallout, or do you want to allow the process to go more normally because you've managed to contain it or keep it down here? And I think that's the debate.
Now, you mentioned Dr. Fauci, and not just Dr. Fauci. Many leaders across the world have come on television. They have got administered the vaccine live on television, and this is being seen as a move to boost confidence among the public to get vaccinated, be a part of the vaccination drives. But the big question is it too early? Does the data suggest that the vaccines that have been approved in US, Europe, UK, they are safe?
Yeah, and I think that's the big reason why you're seeing the lag here in South Korea, right? Is that the government is just waiting to see if it's necessary, again, because the numbers in Korea are actually really, really responsible, right? I mean, it's only something like 1,000 people a day, right? If you look at the Americans, right, where it's, way, way beyond that, right? Korea has actually done a fantastic job. It's been a model on how to control this thing, where the Korean government, I think, is really screwed up, which is what you pointed out, which is that they just didn't get on top of procurement of a vaccine. They can keep this thing under control. They can keep a lid on it for a while, but at some point people are going to object and say, why can't we go back outside? Why can't we have restaurants open and the rest of it? Why can't we actually defeat it? And that would require the vaccine. And here I think the Moon government deserves the criticism that it's gotten in the last couple of weeks, because it's fairly clear the Moon government's not actually going to have nearly enough vaccines for most of the population until maybe the summer next year, 6 more months of this.
That's right, because, restrictions have been reimposed in most of South Korea because, and that's coming just ahead of the Christmas and New Year season. So, people have a right to be upset, especially when other countries have started the vaccination process. But bizarrely, while South Korea waits for its own first batch of vaccines, US military personnel stationed in South Korea will start getting the vaccines as early as Thursday. 28,500 US troops are stationed in South Korea, and the first batch of vaccines for those US troops in South Korea will start arriving on Thursday. So rightfully, I guess, South Koreans are unhappy that why aren't they getting the vaccines?
Yeah, and actually South Korea's bases, the American bases in South Korea, are actually fairly transparent to the South Korean public. South Koreans go on these bases and go shopping and things like that. There are a lot of South Korean workers on these bases. I've been on them myself for what I do. And once the Americans actually start to have the vaccine, South Koreans coming onto the bases and around them and with friends who work on them will start to say, hey, I know this guy at the base, Joe Smith, and he's got it. How come we don't have it? Right. There will also be issues of, will the Americans allow South Koreans onto the bases if the Americans have been vaccinated and the South Koreans haven't? And that could create all kinds of new restrictions. And so that will reverberate out into the South Korean media. And so this story is not going to go anywhere, right? If you have a population of people in South Korea, thousands and thousands of people have been vaccinated, right, and they're distinct from everybody else, that's going to show up in the media, and the Moon government will come under even more pressure. This story isn't going to go away.
Robert Kelly, thank you so much for joining us and getting us all the latest from South Korea.